Let's talk about epidurals. I'm Shelby. I'm a former labor and delivery nurse, a birth and postpartum doula, a childbirth educator, and a first-time mom to a almost 20-month-old baby boy. What is there to know about epidurals? I personally specialize in low intervention birth, so a lot of the families I work with are hoping for an unmedicated birth or as low intervention as possible. But that being said, you can't plan how birth will go. There can be things that are unexpected. Labor can be very long. You can have unexpected complications come up. And sometimes an epidural is a necessary tool. And when used correctly, it can definitely be a positive, and it can even avoid more interventions, say from maternal exhaustion. The other option would be a C-section. So sometimes getting an epidural, letting mom rest, is actually what's needed to prevent major surgery. So what do you need to know when you are making your birth plan and choosing whether or not you're interested in getting an epidural? So first and foremost, what is an epidural? An epidural is a form of pain relief in labor. An anesthesiologist will numb your back, and then they will use a needle to go in your epidural space of your back, inject medication, and then they will take out the needle, and there will be a thin catheter that you don't really have to worry about too much. You just don't want to be like dragging your back on the bed or pulling at it, but you can move with it. They'll tape it up really good. You'll have a long piece of tape all up your back and up onto your shoulder, and then they will connect it to a pump. So you'll get continuous medication throughout labor. So it does not run out of medication. It does give you a continuous drip, and they will likely give you a button that you can press if you're feeling more pain. It'll give you a bolus. So when they first give you the epidural, you will sit on the edge of the bed with your knees up against the bed. They're gonna ask you to tuck your chin and lean forward, and you're gonna want to curve your back like a shrimp or an angry cat. So you'll push your back out, kind of slunched over like this. And the anesthesiologist will be pressing on your back to make sure that they're getting the right spot. And wherever you feel their fingers, that's where you're going to want to push out towards. So when you're pushing your back out, you're going to really focus on pushing your back to where you feel their fingers. They will work with you through the contractions so that it's as comfortable as possible for you. So they'll wait for you to have a contraction. After they have found the spot, cleaned the spot, they'll let you know, after this contraction, we're gonna get started. So then they have about 2 to 3 minutes generally in between contractions to get the needle in. So they will tell you, okay, we're gonna get going. They will numb it. That's usually the worst part, is the pinch from the numbing medication. And then after that, the area will be pretty numb, and that's when they will insert the bigger needle to get into the epidural space. You'll usually feel like pressure and some like poking around while they're pressing on your back to make sure they're in the right spot. Then after they do get the right spot, they'll do what's called a test dose. So they'll give you a bolus of medication, and your nurse will be standing right there, and they will make sure that you're not having any side effects, like any ringing in your ear, any strange taste, like racing of your heart, anything like that. So they're looking for a negative test dose to make sure that it's in the correct spot. It generally takes about 20-ish minutes for it to take effect, but you will start to feel the contractions get less and less intense as the medication is starting to kick in. Epidurals do work by gravity, so you're going to lay like pretty flat. They will either put a little bit of a wedge under one side or elevate your head a little bit just so you're not flat on your back, because we know baby doesn't like that. For about 20-30 minutes, and then after that you are free to move around. But if you do notice that one side is not as numb as the other side, then you might want to switch over to the other side to let the medication go to the other side for pain relief as well. Some common side effects will be drop in blood pressure, and baby will be affected by that too. So along with a drop in mom's blood pressure,
the baby will usually show some signs of distress as well. So their heart rate will drop. Sometimes it's more dramatic than others. They will give you a fluid bolus before the epidural. So before the epidural, they will draw your blood to make sure that your platelet level is good. That is what helps you not bleed. That's what helps you clot so that you don't bleed too much. So they will look to make sure that your platelet level is good. As long as that is good, you will be cleared most likely to get the epidural. Anesthesiologist will come in and chat with you about the risks, benefits, any concerns you have, answer your questions, sign a consent form. They'll look inside your mouth usually, at your dental status, just in case they would have to intubate you at any point. And they'll make sure that there's nothing unusual going on that would prevent you from getting an epidural. And your nurse will have placed an IV. You will need an IV if you're getting an epidural, and then they will give you a fluid bolus. So usually it's like 500 milliliters to 1,000 milliliters. The hospital policy is what will determine this, but they want to make sure that you're nice and hydrated to prevent that blood pressure from dropping. And sometimes it still does, but they can give you more fluids in that case, or there's a medication called ephedrine that they can give you that reverses the effects of that and will help boost your blood pressure. With a drop in blood pressure, you might feel dizzy. Some people actually pass out, nauseous. Some people get shaky. Another side effect of the epidural is itchy skin, and then spinal headache is something that can occur if spinal fluid is leaking. That can cause pressure in your head and a pretty severe headache. If that does persist, there is a procedure called a blood patch, where they take some of your own blood and they put it back into the area where the epidural was to help create a seal and help take away that pressure. So that is the treatment for the spinal headache if traditional methods like Tylenol, Motrin, rest, hydration do not help. So why would you not want an epidural? So with an epidural, it does increase your risk of what we call the cascade of interventions. So this is when you're hoping for low intervention, but then one thing leads to another, and sometimes that ends in a C-section. And currently, the rates of C-sections are about 1/3 of women getting C-sections for the birth of their baby, which is a very high number. Every intervention you get increases your likelihood of the cascade of interventions happening. So this would be getting an epidural and then labor slowing down potentially. So then they start Pitocin, then they break your water, then baby's in distress, then they're doing all of the things to reverse those. And then sometimes that doesn't help and you end up getting a C-section. So that's what we call the cascade of intervention. So everything you introduce does have the potential to go down that road. If you are looking to avoid a C-section, sometimes going without the epidural can assist you in that. Another thing to note about epidurals is you will not have control over your bladder in most cases, if not all. I haven't seen someone who does have good bladder control with an epidural. This means that they will place either a Foley catheter, which is the catheter that stays in place continuously until you're at the pushing phase of labor, or a straight catheter every 3 hours approximately. So they will take a catheter to drain your bladder, take it out, do it again the next 3 hours. So with that in mind, I would recommend going to the bathroom just prior to getting your epidural. Unless their policy is to place a Foley catheter immediately, you would have 3 hours before you have to get a straight catheter. So if you deliver before that time, then you don't have to worry about getting your bladder emptied with a catheter. So with the epidural and with the catheter, anything that you put inside of your body has a risk of infection. So the epidural does increase your risk of infection, and it does increase your risk of infection when you get a catheter in your bladder. Another risk of the epidural is the risk of bleeding, which is why they check your platelet levels as well. So what are the alternatives to an epidural? Coping in labor is a very important skill to learn, which is why taking a childbirth education class or working with a doula is a great idea. Also, getting your partner on board, whoever is going to be there with you, whether it's a family member, your spouse, a friend, getting them on board and making sure that they know how to help you cope and to remind you of what coping techniques you were planning to use, writing a birth plan. All of these things will help you cope in labor and know what to expect. Alternatively to getting an epidural, you can try things like hydrotherapy using the bath or shower. You can use a comb to squeeze, which works with the gate control theory of pain, where your brain can only take so much stimulus. So if you flood it with a distraction and not a painful stimulus, you won't be able to perceive the pain as much. So squeezing, a comb, the TENS machine, hip squeezes, counter pressure, all of those things help with that gate control theory of pain to decrease your pain response to labor. Affirmations, meditation, breathing techniques. You can use Lamaze, Bradley, hypnobirthing breathing. Hypnobirthing is another thing that you can use. Movement, so staying upright, swaying, dancing, using a birth ball, using a peanut ball. Anything that releases oxytocin, so kissing, hugging, laughing. Resting is important, making sure you're well nourished, making sure that you're hydrated. All of these things will help you cope with labor and navigate labor to the best of your ability and make it as enjoyable as possible. The other thing is knowing your why. Why would you not want an epidural? Knowing that is huge because labor is very mental. So your body will keep going longer than your mind will. So if you can get your mindset straight on why you don't want certain interventions, that'll make all the difference. And working with a doula, they are there to keep everything on track. They know your goals, they know your birth plan, they know what helps you, what does not help you. So having them there is a neutral party that is not your birth partner, who's also probably going to be a little stressed in that scenario because they're worried about you and they're not used to seeing you in discomfort like that. So having a doula there can definitely make a huge difference in achieving your birth goals as well. Why should you not rely on an epidural as your end-all be-all? A lot of people go into labor thinking, I'm going to get an epidural, so I don't need to prepare. I will be just fine once I get the epidural. You should have backup plans because you might not always be able to get an epidural, or the epidural might not be effective. Some scenarios where you might not be able to get an epidural: if you have a low platelet count, if you have challenging anatomy, say you have severe scoliosis, or the anesthesiologist isn't able to get in the right space, the epidural might not be effective. Sometimes you can get like a hot spot where the epidural won't work in certain areas, so you'll still be feeling that pain. Sometimes it only works on one side because of the placement. Sometimes your labor progresses too quickly and you can't get an epidural. Sometimes you can't sit still enough because the contractions are so intense that they're not able to get it into the right spot. The anesthesiologist might be in emergency surgery and they aren't available to give you your epidural, so you have to use those coping techniques while you're waiting. Epidurals, just like any medical intervention, are not 100% effective. So you might be able to get an epidural, but they might not provide you the level of pain relief that you were expecting. So knowing coping techniques is extremely important, even if you are planning on getting an epidural, and that there's no question that you want one. You might not be able to, or it might not be 100% effective. I'm not saying this to scare you. I'm saying this so that you go into it prepared so you can have the most positive experience possible. If you have any questions about interventions, whether it is the epidural or creating your birth plan, any other intervention, you can reach out to me. I do offer childbirth education. I offer one-on-one coaching. So if that's something that you're interested in and you want to go through all your options and see what is right for you, please reach out. I can be found at sageandsouldoula.com. You can leave me a comment and we can chat more about how to have the best birth possible for you. If this was helpful, leave a comment, ask any questions you have, share your experience, whether it was good or bad with an epidural, and subscribe to my channel for more videos like this. Hit the notification bell so you never miss out. Thank you so much for joining us. Have a great day.